Motion to add this to the agenda.
I move that we amend the agenda and add the Kansas City Tax Increment Financing Commission update.
I'll second that. All in favor?
Aye.
Okay, all right, Dr. Corvell, you got it on. Now, let's see, an approval of the minutes of the meeting of the, whatever it is, December the 10th meeting. We had a chance to peruse that.
Yes, Chair, I move that we adopt the December 10th, 2019 minutes as printed.
I will second that. All in favor?
Aye.
All right, so have it. Okay. Now,
That should be double check.
Ms. Wilson, would you want to yield to the presentation rather than make, and then we take your financial report after the presentation? Is that okay with you?
I'm fine with that. It's just a real quick finance if you just want to
Okay,
do
well,
that real
let's-
quick.
let's-
Because it looks like I'm going to have somebody
Mhm.
come help me. It's drive I'm using some. It doesn't.
And we don't need to mess with it because we have hard copies too.
Are you sure?
And you can email it around to everybody later too.
Okay,
Okay,
all right.
okay.
Sorry about that.
Then we'll go with you. You want to pass it up and make sense?
Sure.
Okay.
Yeah.
I'll put the in it here and I'll hand this out while you get started.
All right. Well, should we just jump right into it right now? Okay. Perfect. Thank you. Maggie and I are with CBiz, and we appreciate the opportunities to be here today. And had some information in the slide deck. We kind of wanted to quickly go through, and certainly it's a leave behind for everyone, but just to give you some idea on the school districts that we work with and some of the work that we do. So if you take our slide deck right here, again, just would like to quickly move to it because I think the questions that you may have for us and some of the questions we may have for you on the current environment, we think we have a decent feel for it, but would certainly like to know what may help Hickman Middle School District now and in the future as it relates to your employee benefit plan. So if you look on page 2, it's just a quick overview of our organization. So we are headquartered down in the plaza. We have a handful of different business disciplines. The employee benefit side, property casualty, 401k, payroll, flexible account administration. We have a large accounting tax and advisory service that's in Kansas City as well. Maggie and I have a mixed bag of clients, but we're a little bit top heavy with public entities and school districts. We're very familiar with CSD of Kansas City, the school district consortium that you are in right now for your health insurance. We have lost a client to it a few years ago in Smithville. We do some work with Blue Springs on the side, not directly related to the medical plan, but we work with some of their non-medical plans. So we are familiar with it and understand the appeal that trying to put together some other districts can have with the insurance side. So I'd love to get a feel for what has worked out well and maybe what has not worked out well for you under that arrangement. Quickly on page 3 is just the resources that if we had the opportunity to partner with Hickman Mills in any type of capacity, these would be folks directly and indirectly that would be working with you. So Maggie and I would be the lead. Maggie's team has some support. We have a lot of national support. A lot of it happens to be here in Kansas City with our regulatory affairs. With we have employers that we work with, for instance, independents who we have helped that school district set up an on-site clinic years ago. Has really helped drive down their workers' comp costs and also helped with a lot of their wellness plans and having the ability for employees to come there. So we do a lot of different things. Our business here in Kansas City is split right about 50-50 with public entities and private entities. There's not anyone in town that has more work with school districts than our organization. Maggie and I have both been there. I've been there 20 years, 19, 18, 17. And this was before we were there. CBiz had built a niche with school districts long before Maggie and I were on board. We continue to be a part of some teams that work with a lot of your neighboring districts and those on the Kansas side as well.
Can I just add in, one of the people I would point out on here under the account management team or the account team is he's a new member to our team. He serves on a national basis. It's Chris Davis. He's our Health Innovations Practice Lead. He is an incredible asset to CBIZ, and quite frankly, you would hope that over any broker consultant that you would work with would have someone like Chris Davis, because the greatest challenges in the healthcare marketplace right now is how are we going to control our costs? What can we do with our medical plans, with our pricing, with our contributions, to control the costs? Well, everybody has done everything that they can, and the costs are continuing to go up. So Chris is the one who brings a lot of those practices that you find a lot of times start East Coast or West Coast, and it takes a long time for that to infiltrate and make it to the Midwest. He is our resource that is bringing all of those innovations in the healthcare place to us on a daily basis, so that we stay up to date on what is new and what is out there, what kind of solutions can you be putting in place to help control those healthcare costs, whether it's fully insured or under a self-funded contract. So he is a great asset to CBIZ, and he's someone that we work directly with. We have direct contact with him, and would use him as an additional resource with Hickman Mills.
Thanks for highlighting that, Maggie. So on page 4, we wanted to highlight for you the school districts that we work with and we represent and we handle their employee benefit plans or plans with. So on the Kansas side, you see Atchison, your neighboring Belton, Blue Springs, Bonner Springs. These districts we all work directly with and handle their major medical or some major component of their employee benefit offerings. They are all, and what we also want to provide here in a second, I'll kind of get into that. When you look at an arrangement that Hickman Mills is currently in where there's consolidated schools and you think numbers will help drive down the cost, it does help with credibility and it does help with predictability. It doesn't always mean lower cost. We put together our benchmarking information for every district that we work with and handle the medical on the Missouri side and the Kansas side, just for your reference. Okay, our school district clients enjoy looking at this year-round, but mainly renewal time. They kind of like to know what everyone else is doing, where everyone else stands. You're going to see folks that are in a better position than you, and you're going to see folks that are probably in a worse position than you as far as what the premiums are and what the plan designs look like. We're here today to hopefully be a resource to you, whether it's now or in the future. And if you do want to look at other options, helping to transfer that risk that Hickman Mills currently has inside of CSD to potentially another carrier, Maggie and I can't sit here and say that the rates are going to be better. We wouldn't know until we went through that exercise and took the group out, had the insurance carriers and TPAs look at that. We certainly feel we're well positioned if given the opportunity to help you evaluate that. There's also some questions about what type of involvement would we have if you continue to stay with CSD. And I think we'll let you kind of ask us questions on that. We'd like to know what you feel you are getting, maybe more importantly, what you feel you may not be getting as far as services, or maybe you're getting everything you do need. But with us being here right now, it sounds like there may be a need to look to some additional services. So with that being said, again, we kind of wanted to quickly get through this just to at least establish our credibility, let you know that we work in this space. The next page, on page 5, if you're to go out, Maggie touched on Chris Davis, who leads up our Health and Innovations Department. This is a very, very busy slide, and at the core of it and at the bottom of it, if you decided to look outside of CSD, would be third-party administrators or insurance carriers that we would go to. And then in the blue, the reinsurance, the network, and the pharmacy benefit managers are probably what you're familiar with now. I know you're working with Cigna. Not sure where the reinsurance comes through. And then obviously piecing together a pharmacy benefit manager. On the very top, those are things that really get involved in trying to help curb utilization. Something probably doesn't make a lot of sense to spend time on today, but try to want to show you where you start down at the bottom and evaluating options. The core functions are going to be your reinsurance, your network, finding something that's comparable to Cigna now, finding a pharmacy benefit manager that's going to be comparable to what you currently have right now. Then the rest would be conversations that we would have on an ongoing basis if we had the partner to work with you on what would make sense, what would plug and play with some of the core options that you put in place to help drive that cost down, or at least to help be a gateway to curbing some of the unnecessary expenses that can happen with all of our health plans.
And the other thing I would add into that slide is one of the things that you have to evaluate when you're looking at leaving any kind of consortium. There's another consortium, Midwest Public Risk, that we work with, and there are a lot of groups who are looking at options of being able to stand on their own outside of that right now. And a lot of times people will automatically just jump to either just looking at a fully insured type of contract where they're minimizing their risk, they're shifting that all to the carrier partner. Others will say we are just looking for a self-funded contract where we, the district, are ready to absorb that risk on our books, right? The key in that evaluation is really determining which is the right fit for you all, because some districts may be willing to take that risk and go self-funded. Others may want to be fully insured as they come out of the consortium so that they can get a better grasp on what their risk factors are, and then take that step back to self-funded in the future. So that is one of the steps that you would go through in that evaluation, is determining, does a self-funded contract, a fully insured contract, or a hybrid, whatever it may be. That's one of the steps that we would have to go through in that process.
So maybe if you don't mind, we can take a quick pause right here, because we love touching our services, but also just don't want to kind of go through this page by page. It looks like the district would like to at least evaluate potential options outside of CSD. And in the event that those options don't work out, would it make sense to have some additional help with CSD? Do we understand that correctly?
Yeah.
Yes.
Anything we're missing there?
I don't know, what do you mean by additional help with CSD?
Oh, say you continue to stay with CSD and you hired us or somebody else in our space to go out and evaluate options and they just didn't make sense. CSD continued to be the best offering for the district. I thought one of the questions was, would there be additional help, or what would that look like? How could you help us if you continue to stay with CSD?
I mean, we really haven't had a broker since we've been with them.
And you most likely don't,
Okay.
because I
Yeah,
think
because our
that's
short
where the
answer would
question
be
is.
there's probably not a lot.
No.
It's really hoping to see if we can find a more financially compatible plan for what we're looking for, and if not, is the recommendation then to stay within the pool? So
Yeah.
hoping us to explore options, and finding the best option.
Yep.
In
Okay.
terms of whether it be a fully insured plan, self-funded plan, or staying within the pool.
Sure.
Yeah.
So that's what that
And
question
that
should-
Perfect.
makes complete sense, because Maggie and I had met on this last week, and probably not any reason for you to try to compensate somebody outside of CSD for any resource. Don't think there'd be a ton of value for us or anyone else to help you there. As far as, I maybe cutting to the chase a little bit, as far as going out and evaluating that market, do you feel pretty confident in getting decent claims information from CSD to help them? You do?
We do.
Okay.
I know they weren't really
Excited about it?
But
Yeah.
I mean, they've worked with us in doing all this. We even did it last year as well. Just we weren't at the end of our contract yet, but our loss ratio was so high that we did our due diligence and went out, and the premiums that came back were just for fully funded was a lot higher than what we were
Sure.
saying. But our loss ratio is much better. Our agreement with them ends June 30th. We had said June 31st, and then we changed it to August 31st because we had to give 9 months. But then when we met with them, they allowed us to do the June 30th.
Through board
again.
approval.
Yes, through
Okay.
board approval. So,
Okay.
so that's kind of where we're at there. So we thought
Okay.
this was the perfect time
Yeah.
Sure.
to go out and look.
Yeah,
and
this
see.
is kind of the ideal time. So if I understood you correct, the board approval would have to occur by June 30th. You notify them by June 30th of your intent as if you were to terminate from
They
CSD.
already have the notice that
Okay.
it's the intent to withdraw from the pool.
Okay.
However, so if we decide to
Stay.
so if we actually find other options where we are gonna stay with that, the new plan can begin July 1 versus in October there,
Okay.
because
Okay.
there was a delay in our notification to provide that 9-month time span. So
Mhm.
through the insurance pool, the board then voted to allow the district to end at the June 30th time.
Okay.
Okay.
Okay, good.
Okay.
So basically, we're working off of the July 1
The standard, yeah.
effective
July-
date, standard
yeah.
effective date. So
Mhm.
yeah, and the timeline, this timing will align exactly with our normal marketing practice for a July 1 group. So yeah, it is perfect
But the
timing.
sooner we can have information so
Mhm.
that if it is determined we need to stay with the pool, it would be better for us to rescind that withdrawal notice as soon as possible.
Right,
Right.
exactly.
Right.
So,
Well,
it's-
maybe we'll talk timing too. Is that what
yeah,
we're gonna
so
do?
maybe if we kind of talk about the process itself and that timeline, does that work for you? Okay, so, good evening, how are you?
Turning to the board.
All right, excellent, I'm Maggie, this is Matt. You just got here for the good meat of the conversation, I think, so. So if you do in fact have the claims experience, which standardly the market wants to see, 3 years of the monthly claim information, premium paid, large claim. They may ask for diagnosis on the large claimants, prognosis as far as, you know, what are they expecting, how much longer is this person going to be on the plan, etc. So assuming we have all of that information, the typical marketing process that we go through, we would pull all the information together, build that out, send it out to the market. Ideally, the market likes to have a 4-week turnaround in their perfect world to issue a response. We are working with a lot of them. It's closer to a 2 or 3 week turnaround, and that's much more manageable on a July 1 basis than if we were looking at January 1. So we would be looking at anywhere from a 2 to 4 week turnaround for carriers to get their quotes back to us. Once we have the quotes from the marketplace, within a week, it's pretty, well, if we have looked at everything right there, it is usually pretty evident when you start looking at the pricing, whether it makes sense to continue down that path and with the evaluation and looking at additional options, pricing, plan designs. Excuse me. And if it's not the case, we may very well be able to turn around that response to you all pretty quickly. But we would typically ask for about a 2-week turnaround once we get all of the information back from the marketplace, because we all know that when we ask for something, there's always going to be some clarification. We need to get clarification from someone on something. So we need to go through that practice, pull it all together in a presentable format, condensing all of that information in a digestible manner to bring back to you all and present. So I would say the norm would be about a 6 to 8 week turnaround. 8 week would be at the longer end of things.
And that's what we were kind of assuming a March board meeting for us.
Yep.
And that's what we told them, is that we would, the co-op, that we would know what our numbers were gonna look like before it
Sure.
went to the board.
Mhm.
So we would know which way we were going.
Sure. So we responded in the written RFP response. So we're very familiar with the consortium, but nobody's left it, and it's only been around 6, maybe 7 years at the most. Blue Springs, Green Valley, and Smithville were the founding ones. Lone Jack jumped in, and then they jumped out, and then Hickman came in. You all came in a few years ago. So the market certainly is going to want to take a look at an organization your size, public or private. There's not a ton of organizations your size that are out there. How we go and do that for you, it's really access to your information, and it's getting with our actuarial folks, putting together a package to get off to those carriers. As far as the pricing, we wanted to just talk about, I was tipped off a little bit by Smithville when they told me that your enrollment platform with Cigna was going away. So we work with Kim Davis up there. Maggie and I worked with them for years. We've stayed involved in the capacity outside of their medical. But she looked at us and said, we need an option for that. So we had some presentations. They picked a benefit provider for their enrollment to help with the feeds to the insurance carriers, but also as providing voluntary products to their employees. Don't know what the relationship is at Hickman with any other providers, but there's an opportunity that if we were chosen to be your partner to represent you and go look at other options, we could go that path where we would talk to enrollment partners. What's involved from the district side, though, is enrollment counselors enrolling individuals in the core medical plan, core dental plan, but offering them voluntary products. Okay, so the compensation for those enrollment counselors is built in there, and then we share with them like a third. 30%, they take 70%. So if you didn't want to get into, and it worked out for a number of different reasons to help educate the folks on whatever the offering is. If it's continued to be COSD or you switch to Cigna, or maybe not Cigna, it's a good example, United Healthcare, you could use an enrollment partner to help enroll. We would do the marketing work, knowing that we would eventually be compensated on voluntary insurance products if they fit the culture or the need of what you want to offer your teachers and district staff. Some districts shy away from it. We've seen more and more who say, you know what, let's educate our folks on how the plan works. As long as these counselors or these enrollment partners are not selling and trying to push product, we're comfortable with it. And Maggie and I have good partners. We'd be happy to, after this meeting, send you references of other school districts. I work with Kansas City, Kansas School District. They're on their 3rd year of face-to-face enrollments. The feedback is very positive. They know that if they sit down and see a majority of your district, they're going to have 15 or 20% of the folks buy some plans that's going to fund their investment and take care of what resources they put into it. That would kind of be a no-cost option. If we want to look at a flat fee, we just propose in here the marketing of the plan would be $15,000. Not a ton of science behind it, just knowing that the work of a district your size and the team that would be working with the insurance carriers, putting together proposals, that's kind of where we came in at.
In that evaluation, so when we go through that evaluation, that's not just of your medical plan, because if we wait until March to determine if you're leaving the medical plan, it's going to be really late in the game in March to then start determining, evaluating the enrollment technology or benefits technology and all of the ancillary lines of coverage. So you would want to market all of those lines of coverage so that if you do make that jump from CSD, we've got all of our ducks in a row for all of those other lines of coverage. Because once you get to March, you're almost at July 1 when you start thinking about the benefits and communication, open enrollment timeline, and all of that.
So we have a broker that we work with on the ancillary products
You do?
already. So, and then our dental and our vision, we are under contract with the amounts we have for another 2 years. So really
For
what
CSD?
we're looking at, no.
Okay, so you kept those out of CSD. I know
Outside.
Smithville had theirs in there. You've kept that all outside of it.
Right.
Okay, okay.
Okay, I do have a couple of questions before they leave my brain. Can you provide me with a sample of your voluntary products?
So an example of the voluntary products. So they've been referred to as worksite products as well. So that would be like critical illness, the accident, hospital confinement. They're the employee paid services that are intended to complement a healthcare plan. So if you think about on a high deductible health plan, and you're responsible for your, let's say it's a $2,500 deductible. You go into the hospital. Under an accident plan, it's going to have a benefit that it's paying to you. So when that happens, you're going to get a check from your plan. In a critical illness plan, if you end up inpatient or with cancer, there are significant lump sum benefits that are paid to that individual. So they are offered the option. They don't have to take it. It's just an option presented to them. If they want to enroll in it and something were to occur, then they have that benefit that's going to pay them if they're in an accident, critical illness, those types of things, to help offset the medical expenses that they're going to be incurring, travel expenses if they do need to go to MD Anderson or someplace else outside of Kansas City for care. It helps to cover some of those expenses as well. So that's voluntary.
Is that at an additional cost?
To the employee.
To the
Yes.
employee.
It's an
That's
employee
okay.
payroll deducted benefit, yes.
And we have all of that right now with, through Unum as our provider
Yeah.
at the moment. So we do offer all of that, plus the life insurance the district provides to each employee.
So I would say the key thing that when we're talking about the benefits technology, today, I assume you're using the Cigna platform that's
Yeah,
offered through
Cigna.
Cigna. Okay, so that's going away. So then you look at how do we replace that? What are our options and what is the cost associated with that? The cost for a standalone enrollment technology platform, you are probably looking at no less than $10,000 a year, probably closer to $20,000 a year if you, the district, just said, we want to go and buy that same technology to enroll our benefits and service that throughout the year. So what has happened in the marketplace is all of these voluntary carriers, the critical illness, cancer, all of them, what they have started doing is saying, if we are able to offer these benefits, we can get that enrollment technology at no cost or little cost to the employer, okay? Especially with public entities, $20,000 a year for that enrollment technology is pretty darn hefty, and most of them aren't going to be able to foot that bill to maintain that. So a lot of them, that's the route they have gone, and so it goes through, they do a marketing of those voluntary benefits, so you would end up with benefits that are much like or exactly the same or better than your current Unum products, and the pricing the same or better than. So then employees are offered those same products through these carriers, that then that money coming in the door through those employee paid premiums is helping to fund that enrollment technology. And so that's why when we talk about these partners, it can be important to be open-minded about evaluating the Unums or the Aflacs or the American Fidelity, whoever it may be in place today, because it helps to supplement the cost of that enrollment platform.
Yeah, so KCMO and KCK both use the same enrollment partner, and they have for a number of years. Maggie and I are meeting tomorrow with Fort Osage, who's a client of ours, and they're interviewing 4. Some of them are on page 6 to replace their enrollment system. It sounds like there's a current broker doing that, so they could maybe help you get there.
We've been speaking with them about doing that, yeah.
Yeah. So that was, it was just a thought when I knew that it was going away, just via what Smithville said, just to kind of bring that up. Again, just to kind of have it out there and be transparent on the cost piece, if we had the opportunity to partner with you, and we went out there and there was another option that you felt, after we evaluated and sat back there and looked at the pros and cons of CSD and the other insurance proposals, we'd just waive the fee, and then we'd talk about compensation being built into that medical plan going forward. Absent of that, most of our school districts, I can't think of one off the top of my head, have any type of fee arrangements. They do choose to have the compensation built into the premium. There's a little bit of a cost sharing component when, if you're paying roughly 80% of the total premium, the employees are paying 20, a little bit of that's going to split up that way. But that's all conversation that, we want to be open and transparent with you all. We can show you what other districts do, show you what their arrangements are. Being as active as we are in the space, spend every couple of years with our clients making sure all that is out there, actually every year with our annual performance review, making sure that everyone knows exactly where the compensation is, and hopefully what that district is getting out of us in the scope of services, the day-to-day, the month-to-month, and the quarterly work that we do with our clients.
What is your percentage for that rate if we went broker? So what would your percentage of the premium be for your?
So good question. Like with each carrier, it's a little bit different. Blue Cross Blue Shield, for example, who I know you were with prior to moving to CSD, they have a sliding scale. So we just go off of a sliding scale. So the more premium you pay, the sliding scale goes downwards. Some carriers prefer to pay on a per member per month. Sometimes it's just a flat, 1%, 1.5%. It's really worked out with you, in conjunction with you. We can't do anything without your permission anyway, or we're not going to do anything without your permission. But I would say for a district your size, 1.5% might be where you'd fall kind of on a sliding scale arrangement, or if we just had a flat 1.5% built in there with the insurance carrier. So I know it's not a concrete answer, but it just really isn't until we get the proposals back. And obviously, if we're to the point where we're talking about that, these proposals are going to look superior to where you currently are with CSD. And our role is to say, well, okay, carrier A, it's great that you have a competitive proposal for Hickman Mills. Let's talk about year 2. Okay, they're not going to put rate guarantees on it, but we want to make sure that they're not buying the business, and then we have this little Band-Aid on Hickman Mills for a year, and then next year they're like, we got you. Okay, yeah. We can't 100% prevent that from happening, but we certainly want to have those carriers in here meeting with all the stakeholders and saying, your first year is going to be immature. They don't need all the premium they're collecting on you, but they're going to try to build up the reserves for you. What's going to happen year 2? Can you at least kind of have some type of loss ratio formula where we know if we're tracking here, this is roughly what the increase is we might expect for year 2. It's hard on a group your size, but the more data we, or if it's another partner that you choose, has to take out to those carriers, the more credible, the better position they're going to be able to put themselves in. And it could be favorable, or they could come back and the exercise could say, you know what, you still are better down this continued path with CSD.
And I think a key component in that is you talk about, okay, your claims hit the books, it's already happened. It's not something you can control after it's occurred, right? So, as you're talking about those projected numbers based on claims that have already been incurred, we also have a process that we build into the annual timeline. We call it an annual performance review. And it occurs about 3 months, 2 to 3 months after the end of your plan year. So it would probably happen about September, October each year. And essentially what we do is you've already checked off the renewal, you're through the renewal, but we're sitting down with you at that point to develop, okay, 3 years strategically, where does the district want to be? What do we want to be looking at? What kind of cost containment innovations are out there in the marketplace that you are interested in putting in place? So as we're looking at these claims that have incurred, what measures can we be putting in going forward to help control those costs in the future? So that's a key component. I know a lot of times the focus is just on that medical renewal and that medical plan cost, but by the time you get to that, it's based on past claims. So what the focus has been is what are we doing to control those claim costs in the future? Another big piece of that is, and I'm just jumping forward, employee communication. On page 9, our employee communications are, I like to brag about them because they are very robust. So we aren't just sending out an annual open enrollment communication, okay? We have the communications for open enrollment. There's an annual communication calendar where we are working with you. A lot of times we'll pull it together, or if you want to play a part in developing it, we are essentially providing you the pre-drafted emails that are branded, Hickman Mills branded, to send out to employees. That could be weekly, that could be bi-weekly, that could be on a monthly basis. But because a lot of times what employers are struggling with is once we get past open enrollment, everybody is just like so bogged down with information, you don't even know where to start in sending out carrier A's flyers and carrier B's flyers and what to do with all of that information and the most efficient way to get that information to employees. So of those cost calculators, where they can go to shop their cost of their medical services, those are those pieces you want to continually have at the forefront of their mind so that when they need it, they say, I remember I have access to something. Let me at least go back and refer to this email or ask my HR department or my benefits department. So we build that annual communication calendar for you so you aren't trying to figure out what to send out. And then our communications are sent out, you can do paper communications if you want, but they are also available through, it's a flipping book link, so it's all electronic. So an employee can open it up on their computer, they can view it on their mobile device. Within that open enrollment communication or any ongoing communications, there are direct links to those carrier resources, to the carrier websites, to our team with our contact information. So it is a user-friendly document so that those people who like technology, they've got it at their fingertips, and those who like the paper, they have got that available to them as well. Also, there's a lot more the texting technology. A lot of employers are trying to figure out how to go that route because we read what comes over on our phone. If we get a text, we open it up and we are reading that. If we get an email, and I'm guilty of this, you guys, when an email comes through from my benefits department, it's going to the bottom of my list because it's in my work email. And my work email is the top item.
We have added on through our benefits email at CBIZ where our benefits department has called it something about deleting word. As long as you open it up, you have enough time to read it as you're getting ready to click the delete button. There's more than 3 or 4 sentences and that is it. So I do think we have these wonderful tools and wonderful resources which all mean nothing to Hickman Mills unless you have the opportunity to have an insurance carrier say, you know what, we want to jump on this risk. We'd like the opportunity to work with you all. And I think one thing we share too, and would love to hear any more questions you have for us, if we did get to that place, okay, it's one thing, a lot of folks will be able to place your insurance or have a carrier interested by giving them all the data. If you look on page 10, this was a Raytown School District case study. 1,350 employees on the plan. They've been with us for 6+ years now. So some of the challenges they had was obviously the same challenges that Hickman Mills is faced with, limited funding. Their trend was about 9% a year. Communicating and try to increase participation. We have districts, and I'll use Kansas City, Kansas as an example. They have 500 of their 4,000 employees every year that do not enroll in a 100% paid for plan. And we have tried so many different ways to try to reach. Now, could be military, but for the most part, there's not many employers, as everyone knows here, that's paying 100% of dependent costs. So trying to reach those folks, say, we're putting $600 towards your insurance premium a month. Please enroll, it's a benefit to you. So our wellness team, which Maggie and I work with in conjunction with, but they really take over their own direction, and they help our employer groups, they help our school districts, they work with benefit committees, they help create wellness committees. They helped at Raytown get some involvement and help decrease their trend. It's not automatic when you get a wellness team involved that everything's going to go down, but it certainly can help. We have the ability to share with you best practices from other school districts. If you're not already real active in the wellness space, we could help you, kind of hit the ground running where you're not developing all this from the get-go. We could come in, our folks could help your team get up, and we could control, as Maggie mentioned, the communication. We could control a wellness calendar, the wellness events. Whatever you ask out of us, we would be able to help with, and we have tons of resources and referrals within the school district community that you can talk to about the work we've done with the engagement and well-being. So I know we've talked a lot, and I hope we haven't talked too much. We really, really appreciate the small amount of time that we had with Hickman Mills. It's been years since we've tried to find our way in here, but glad just to have the opportunity to at least introduce ourselves. And if it's not now that we're able to help you out, we hope you keep us in mind for any type of future opportunities, or if you want to use us just as a resource for something, if you want to call us with questions, we'd be happy to share what we think we know. We'd welcome you to call any of these school district clients that you see in our materials or on the benefit comparison. And Maggie and I are one of probably 4 teams that are active in our company with school districts. So it might not be us that they know, but they could speak to the work that our teams do with them. So anything else for us? Did we hit on everything that was hopefully to be hit on?
I have a clarification question in terms of the process. So if you were selected, you conduct an analysis of the district and what our past spending has been in terms of insurance within the pool, and then provide a recommendation for us as a district if we should pursue fully insured or self-funded, and then you go from there and getting quotes from insurance companies.
We'd have both first. We'd have the quotes first for fully insured and self-funded.
Gotcha. Okay. So
Yeah.
okay. All right.
Yeah,
So
so
we
we have
skip
all
a
of the
step.
information, and then based on that pricing, you're ready to run
No matter what.
forward with that, with that information of what direction you wanna go.
So in terms of fees for you, that's determined based on
So for
Were
that
there
marketing
two
process,
options we had in
Mhm.
terms of
Right. So
sliding scale or a
so if
25% is what I think you
if
quoted.
we went through the marketing process, didn't touch the voluntary stuff because you're comfortable with your current partners and consultants there, it'd be $15,000. But if you found a carrier or a carrier found you, or it made sense to exit CSD plan, we just waive that fee, and we'd have compensation, disclosed compensation that's mutually agreed upon, that's built into the plan starting 7/1. So there wouldn't be a direct cost. You certainly would have. There wouldn't be a direct fee. There would be that indirect compensation that's built into your old plan. That's built into your current CSD plan. It would be built into another option you had, and that's like the 1.5% type number. Just
and
to
some
give you
groups
parameters.
do, they prefer, a lot of public entities prefer, if you were to move forward after the marketing, to do commission because it is built into the premiums, and so district has a largest chunk of it, but employees are sharing in some of that cost because it's built into the plan. Other employers, a lot of them on the private side, prefer a straight fee-based arrangement, so it would be up to you all to decide, do you prefer to pay a straight fee out of district money to CBIZ, or do you prefer to build it into to the commission?
And so we provide reporting on a monthly basis that's showing you where all the dollars are going. Administration costs, reinsurance costs, pharmacy costs, medical claims, us, ACA type fees, if there's capitation costs due to an HMO. It's all going to be line item every month, so you'll know where every dollar's going. Sometimes districts don't like where it's going as far as the medical spend, but we're all in the same boat there. I mean, our organization has 4,500 employees, and we had an 11% increase last year on a $50 million plan. I mean, it's ridiculous. Our trend, just because we're larger, was no better than a lot of other groups we work with, and 11% on that number. It's as we especially work with our public entities and our school districts where you have one bucket of money, and if more is going over here towards this insurance plan, we're talking less on steps and less on salary increases, and it's hard to communicate that to folks that aren't sitting at this table, but.
And part of that communication, it was out at the city of Grandview. They came out of a consortium 2 years ago. And so it's been a process of educating employees, because employees, most oftentimes, nobody understands the insurance world. They just understand that I got a 10% increase and my salary increase was not that. So I'm taking home less this year. That is all it comes down to. Or my deductible went up $500 and it's costing me $30 more a paycheck to have this coverage. Like, that bottom line is all that they're really seeing and feeling. So a key part of that employee education is trying to get employees to understand what you as the district are doing on their behalf, not just at the renewal, but throughout the year to help control the costs. And but what it comes down to is the district can provide them the resources and all of these tools, but it comes down to the employees taking advantage of those tools and doing what they can. And that none of us, we all are living in the same healthcare environment with our medical costs going up every year. We are all feeling it systematically until something is fixed. We have to continue to work in this world that we have and in this environment that we have. And so for employees, as they're getting frustrated, it's important that the communication to them is that, hey, we are doing these things. Here are what we are doing every day to help manage your costs and provide you what you need to manage your costs. So that's also the open enrollment communications. You go all the way back to the middle of the year communications with those employees as well.
Just out of curiosity, what is the district contribution for the employee-only premium? What's kind of the base contribution per month? If you look on the second column right here on Missouri, where it has district contribution for the clients you work with,
We're right around 780.
780,
Pretty high.
which is pretty high.
Pretty darn high. So
But we have, the plans we have are really,
really good.
I mean, considering our loss ratio,
right.
yes.
So one of the other things that you have to look at, you're looking at the contract type, you're looking at the plan design, you're looking at the cost of the plan, but contribution strategy is a big piece of the puzzle. We get through, we look at the plans, we look at the cost of the plans, we look at your networks. One of the last things you get to is, what is the cost? What is district going to pay? And how can we help strategically in that contribution strategy steer these employees to a plan that may very well benefit them over where they are today? And that is, again, back to employee education.
I want to cut this interesting discussion off. It's just education. And I could go on, but I know you've got someone else that we need to hear from also. But I think that, as one of the persons, it's education for me, because what I know about this is what they took out of my retirement check. It ain't good.
It's what comes out of the check.
Thank you so much. Anything else?
No, I'm good.
Anything else?
Thank you.
Thank you all. You have a great evening.
Appreciate it.
I'm sure I'll have questions.
It's great meeting you. Congrats on your award last year. Congrats on your award last year.
Thank you.
You know Carolyn, have you met Carolyn Watley?
Yes.
She works with us. She was our president until a couple years ago.
Yes.
Great meeting you.
Very nice to meet you. Yeah, just
Nice to meet you.
reach out
Thank you
to
for
us
having us.
and
Appreciate it.
Thank you all for
Yeah.
coming.
All right,
Appreciate it.
thank you. Very nice to meet you. Yes, nice to meet you. Thank you.
Excuse me.
Nice to meet you.
Thank
You all have a great night.
Thank you.
Two. Yes, yes, camera phone.
Huh? I have a lot of questions, but I'm gonna wait till after this next one. Yeah.
Remind me, I wanna make sure that I get into the minutes that, Director Watry was excused, not absent. Well, make sure there's some minutes that Director Watry was excused. Okay, no, that's, okay. That's an education, I don't know what it, and so many questions, I didn't know
I
what
have so
to.
many, I just was gonna, I'm gonna wait until after I listen to the second one, because I have about 5 of them. I'm curious about this option 2.
So,
And what's the difference between that option and what we're currently doing?
so they would be examining the field to determine whether or not we ought to stay into CSD or could come out of it and go with the other
Would
option.
appear and be either fully insured or self-funded, but we would be in a pool where you're paying a baseline premium, but then anything over what the premium is, we have to come over. We have to come over with it on a monthly basis.
So
If you're in a plan, it's your set rate for what it is. They may do a lot to get us, and then the second year, premiums spike. It's based on the overall health care, overall health needs of our employees.
Everybody's following us. I remember, I know you, Mr. Brooks, I'm Bob Charlesworth.
Nice to meet you.
Police Department's
Kevin Casey, very nice to meet
I
you.
remember when you began on the
How
board.
you doing?
I still do,
Very
yeah.
nice to meet you.
I still do. You too.
Kevin Casey, nice to meet you.
Oh, hi, how are you? I'm Bob Charlesworth.
Hi, Alfred, how are you?
Kevin Casey, very nice to meet you.
Nice to meet you. How are you?
Casey Fatline.
Casey? Nice to meet you.
Please,
Oh, thank you.
thank you.
insurance is free.
Since I cannot get this to work, they do have a paper presentation for us, so I'm gonna have to
You have some handouts somewhere?
We've got paper as well, we're good. Oh, yeah, be great.
Did they take the extra books with them? They took the extra books from,
Oh, did they? I can give you,
no, for the other.
oh, for the board?
Yeah.
I'll reach out to them tomorrow.
We wanna make sure we keep, and we're gonna keep the extra books.
There you go, no worries.
Hey, gentlemen, welcome, and you met everyone around here. This is the Finance Committee of the Board. I told the chair, the president's Greg's on there also, who is not with us, is Director Watry, who's not with us today, but it's your show, huh?
Well, thanks. I know we've got a short amount of time, so we're gonna get right to it if that's okay. My name is Bob Charlesworth, Charlesworth Consulting, creative name. You'll see in a little bit, this is my 35th year in this business. Still love it. And we're going to be a little bit different for you today. I brought with me Kevin Casey. Kevin is a senior benefit consultant with my parent company, which is called Holmes Murphy. Holmes Murphy is it's a employee stock-owned company. Kevin being one of them. I am not. They have a retirement age, and by the time I qualified for it, I would have never been able to buy it. So I was not able to do that, but we were acquired on 11/1 of 2017, and I was looking for a succession plan, is what I was looking for. I represent 5 state retirement systems, and they all asked me pretty much in 1 week what was my plan going to be. So we looked around, and I actually used to do the RFPs for clients to help find the brokers. And so I got to know everybody, talked to a lot of them, and one day we sat down and said, you know what, culturally, creativity-wise, the fit is with Holmes Murphy. And the reason we did that is that they allowed us to continue our own company. And so what we have for you here today is really a twofold approach. One is to start off as a pure consultant that'll be under the Charlesworth name. Because right now I have no idea I understand your program, and Kevin has some, he's gonna talk in just a little bit regarding your current provider. He's done some more detailed review of that program in another school district. We wanna review it truly, objectively, holistically. Find out what's working, what's not working, what may work with your philosophy now and in the future. We understand the marketplace quite well. So from that, it's kind of a two-phase approach. We come in, we really get more data, understand where your goals are, your culture is, what you're looking for. From that, we're actually going to approach the marketplace. We're probably going to have some limited data. We know that, and that's okay. But that way we can kind of figure out what may be a soft landing spot if you all choose to leave the group of which you're in right now. And with that, you need help. And that's where Holmes Murphy comes in as a broker of record to do that. I know the consultants you'll talk with, it's all one shop, and that's fine, but we like to keep it separate. That way, if you don't want to move that way, it's not a problem with us. Proposal, and we'll walk through here in just a second. We have a fee associated with it. If you do move to the another organization, there are commission structures that we need to talk about today, how that works. Our phase 2 fees are waived. And then I actually become a team of Holmes Murphy. It's kind of funny, I don't even carry a Holmes Murphy card. I have a Charles Consulting card. So let's walk through this real quickly if you don't mind. Again, a little background, that's us right there. The team that I brought here is Kevin, of course. He's the team leader, he's got a lot of public school experience. And then we have a large team actually there. We're in the Crossroads District, about 19th and Walnut is where we office. So we're usually only 20 minutes away. About 42 if you have traffic coming at 5 o'clock. So just as an FYI, takes a little time to get down here. So we're a little bit different. We're a little bit different of a spin. So why Charlesworth and Holmes Murphy? We think we bring objectivity to it. We truly work as consultants. I've always worked as a consultant. I don't work for free. I never have. I don't expect you all do. Well, some of you might as board members might donate your time gracefully.
Checks in the mail.
Yeah, I've heard that one before too. And I know when Councilman Sharp used to be on the board here years and years ago, I used to work here at Hickman Mills as your consultant. That was his opportunity as well, I think. But we have public entity experience. Right now, under the Holmes Murphy umbrella, we work with Blue Valley Schools. Kevin is intimate with North Kansas City Schools and Liberty Schools, and we have others as well. And I was privileged to be your consultant here at Hickman Mills for over 15 years, probably closer to 20. I can't remember exactly when that ended. I think it was in 2012. There was a change in board members and leadership, and a new direction was taken, and I just bowed out at that point. And that's fine. So bottom line is we want to do a marketing look, but if you leave, you got to have a soft landing spot. Phase 1, as you can see here, it's 8325 is what we quoted. We need to figure out how it's funded today, how it works, what your budget looks like. Your contractual obligations is probably going to be the biggest key. And Kevin, why don't you touch base real quick? I know you did some review on another school regarding the SIP Kansas City group. And you might just touch on some of the key points that you looked at when you looked at that.
Yeah, I mean, have you guys given notice that you wanted to leave?
We did.
Okay, so you gave the 9-month notice, so that takes out the, at least when I reviewed it the last time with North Kansas City Schools, they were looking at it. It was a 9-month time period you had to give them. If you didn't give them that time period, I think there was a 6-month penalty of premium at the time. But to Bob's point, that's really our job, is to dive into the contract. At the time, and they keep the contracts very, very tight. So trying to get one of those is almost impossible. So the one time that we did get our hands on one, those were some of the provisions. And it also included provisions on if you left, the IBNR, the incurred but not reported. How much do you owe on that? Is it uncapped? At the time it was uncapped. And so trying to I don't know if you guys have reserves set up for if you leave. Things like that, but that's all the kind of consultation that Bob's talking about of, okay, what's the contract today? It may be great that we want to go somewhere else, we may get a good price, but if we have these run out fees, we have these run out costs, we have these claims that are uncapped, the time period in which those claims, one of the things that we would try to do, and I know Bob has it in here, is really project that for you. Is that going to be dead on? No, because obviously that's almost an impossible number to project. But we wouldn't just look at it over the last 12 months. We would look at it as long back as we could to try to get the most accurate number for you if we were to leave. So it's a lot of those type of different things. And then, do you want me to get into moving forward?
Well, yeah, before we do that,
Yeah.
part of the moving forward piece is knowing the landscape of the insurance companies. And I do want you to jump in on that, Kevin, because as we talk. But one of the things we want to talk about, there's another association of trust that does schools in the Kansas City marketplace. It's called Midwest Public Risk. NPR is fairly large. They do a lot of cities. They have a lot of schools, but most of the schools are very small. But they're also accessible. They also don't provide loss data. They also have terminal liability provisions, so if you leave, anything that's not paid after the third month is your responsibility. Of course, your response to that is, well, what do my claims look like? Well, we can't tell you. We can say that you're fairly good or decent or whatever, but it doesn't give you a whole lot of confidence in leaving. But my point is that there are other trusts out there if you're interested in association type programs. But there's no guarantee that you're going to leave where you're at today unless you all already made a decision that we are just done with this group, we're out of here. But part of the process of marketing is to include them in the process as well, because there may not be a soft landing spot for you, and so we can't guarantee that. But I think we have enough, and everybody you're going to talk to probably has enough business with all these carriers, and that's fine. But we have great working relationships with all the carriers. Kevin was just teasing me about one of our school districts in the hall while we were waiting from Aetna. Aetna came in with a program that was just like, holy cow. But as Kevin dug deeper and deeper into it, oh, by the way, they decided to pull their quote. Why? Because they found an error in it that was brought up by him. And the last thing we want is to move something and all of a sudden says, oh, this isn't going to work. And then have to redo it all over again, or how do you explain that to a board? So, but that's the first phase, trying to figure out what we want, where we want to go, and how we want to approach it. So that's phase one. I'm going to let Kevin touch phase two, because that's where he's going to get mostly involved in trying to negotiate with all these carriers.
Yeah, so when we're marketing, like I just talked about, there's a lot of unknowns from where you're coming from, just from a risk perspective, things like that. So when we look at the market, we want to put you guys in a position where there's things that are known out there. The great thing that we do, that all the carriers appreciate, our relationships with the carriers are, I would almost say, unmatched because of some of the things that they've done for us over the years. Is we make sure to put you guys in a spot where different isn't always bad, different's good a lot of times, and that's what we really do. We explore every single thing that's out there, and I think it really goes to show you how much respect that the carriers have for us. With our school districts, two of our school districts had the only rate guarantees on the books with Blue Cross. Blue Cross's entire book of business, they had no other companies that had rate guarantees except for two of the school districts we worked with. And that's because they respected the work that we did. They knew the wellness approach that we were going to take. They knew what the claims look like for all of our groups that work with Blue Cross, how they get a 2% trend level, on average when they implement the wellness year over year with us. And so, what I would ask for you guys is we're going to be the most creative people you've ever seen when it comes to how to get out of the trust, because I know the trust is it can be difficult. You got calls being made on claims. Financially, it's very difficult, and what we're going to do is we're going to be super creative, not only around plan design, networks. We're going to push the carriers to be their best. We're going to push the carriers to give you guys certainty moving forward, not just having, okay, well, this looks great year one, what's going to happen year two? No. Understand the client. Understand where they're coming from. Understand the pain points that they have, that they're leaving with all this uncertainty. They're really throwing their hands up saying, hey, we're putting our trust in you guys. You guys need to partner with us to give them a spot where they know what year two looks like. They know what the potential looks like down the road, not just, hey, let's buy their business for a year, and then next year, it's a school district. My wife was a teacher for 17 years. This is the last year she didn't teach this year, but she was a teacher for 17 years. I understand how this works. There's so many different things out there. I know with her school district, they worked with Humana really closely, and Humana provided them rate guarantees based on their Go 365 wellness. How many people interacted with that program. We've done crazy things with Blue Cross. And the thing about Holmes Murphy that you should know is that we're not afraid to be the first ones, because we feel like we know these products just as well as the carriers, and so we're not afraid. If we feel like there's a suggestion out there from a carrier or a possibility from a carrier, we are not afraid to bring that to you and be one of the first ones in. That's, North Kansas City, Liberty Schools, they were the first ones into the Blue Select Plus network. And a lot of brokers would sit here and be like, oh, I don't know, that's new, this and that. Well, yeah, it's new, but if you do your homework, you do your due diligence, and you do your homework, you figure out if it's the right move for you guys. We tell you everything that goes along with it, and then comes the second phase, communication to your employees, which we've mastered. Blue Select Plus is a limited network with Blue Cross. Those two school districts have every single member on their plan. They don't have access to St. Luke's. They don't have access to, a lot of providers. That's the only network they utilize. But we communicated with their employees in a way where we help the employees find new doctors. We let them know way in advance that this was going to be happening. Our communication was done so well that when it came to the effective date, we didn't have people coming to us saying, hey, I didn't know this. What happened? What's happening? So that's what you should know about our marketing process. And I know we're a little limited on time, but just know that we're going to be different. We're going to push the carriers. We're going to make sure you guys know everything that you should about any type of products out there. We're going to find solutions that make make sense going forward, not just for 1 year. There will be no button unpushed when we do the marketing.
There's a sample timeline in there, and that is truly a sample. Point is that we're both very familiar with school districts and public entities in general, and quotes have to come early.
And we had a change.
You had to change.
Yes, well, we initially said that our plan ended June 30th, and then we put out an addendum because we did the 9 month.
9-1. Mm-hmm.
Well, the co-op has approved by their board that we can actually do a June 30, so we're back to the July 1 start date again.
Well,
Perfect.
that works.
Okay.
It just kind of
Just want to put that out.
pushes it up a little bit, and
Absolutely.
it's kind of like a no nonsense timeline, and that's okay.
Okay.
But your decision needs to be made pretty soon. Can we start on the 23rd? It's my
Well,
anniversary. That'd be a good day to start.
We're actually going to the board Thursday, so.
Okay. There you go. One of the deals I put together here is a what if scenario. What if you remain with the group? I mean, there's no guarantees what we can find or not find. But, our service project does end and our under the Charlesworth deal, and the fees are what we noted here as well. But one of the things that we do, which is kind of unique, and I do it with Kansas City, Missouri Police Department, they're a client of mine. I charge usually a modest per employee per month fee, and I'm not a broker. I'm just a pure consultant. And so I have clients that are part of other trusts, and they just want me as a sounding board. And it's not me, it's the team, and a lot of times I kick Kevin, around a little bit to help me a little some. But for, like in this one, I've made a proposal here. It's $3 per employee per month. But we help with other strategies. We talk with contribution strategies, compliance issues, just understanding a renewal process. So even if you remain with a trust, a lot of people will hire us just to make sure I'm a hired professional babysitter in group benefits. Think of it that way. But I do serve that role in several clients. So that's not foreign to what Charlesworth does. A little different from Holmes Murphy, because brokers usually don't like to talk to each other. But with me, I work with several brokers in the area. I work with a large group in Oklahoma City with Gallagher. So it's not foreign to me whatsoever. But that is an option if you decide to remain, and once it's still an external resource to kind of help you along as well. Kevin's already talked about the what ifs. If we move to a new carrier, there's going to be all kinds of educational meetings. I've seen the team. They go to strange hours, strange places, you name it. Schools are not new to us. And so we understand school schedules. My wife's a middle school librarian in Olathe schools. She works the strangest hours of any middle school librarian I've ever met. But that's what she does, and that's good. And so we're not foreign to evening times, early times, or anything like that. And of course, if you move to a carrier-based program, the phase 2 fee with Charlesworth is waived. One of the things that's always challenging, we might as well be upfront about compensation structures. You know, brokers are compensated kind of weird. We're fully transparent. We're on a month-to-month. If you don't like us, you can fire us. That's simple with Holmes Murphy. Excuse me. What we've outlined here, it's kind of a range. We told you what our estimated fee would be. That can be compensated in a lot of different ways, and we're fully transparent. Here's an example. If you go to Blue Cross of Kansas City, more than likely the commission structure will be 0.5%. What does that do? That triggers what they call an administrative override, which does not impact your premiums. To them, it's like paying a light bill. It's part of their overall expense. Well, for years that was never disclosed until the Spitzer claims issue. If you remember the Elliott Spitzer debacle and bid rigging that was happening in New York, that came down, and then full disclosure was paramount. And so we may, as Holmes Murphy, there may be other compensation structures. So that's why it's varied. It's from 0.5% to 1.5%, or it could be a per employee per month. We don't care as Holmes Murphy. But there's going to be a team of several people that are on it, and that's how the compensation structure works. So, you know, we're fine with the number, but our point is we want to be fully transparent so you can see how we're paid. There are times we have clients that allow us to do the ancillary lines, and I don't know if that's part of your discussions now. It hasn't been. As part of the health was just health. Point is that there are some ancillary lines that are commission based. They always have commission in it. Sometimes we take those and lower these amounts or use it to help you buy enrollment systems. So my point is that in group benefits, unfortunately, a lot of people are secretive about their compensation structure. We are not. Fully disclosed. Excuse me. The last two, really didn't know how much time we really had. Our values and aspirations, people tease us about that a little bit, kind of corny. But I got to tell you, we live them. We have so much fun. We celebrate all the time. Courageous Influence is my favorite one. And Kevin kind of touched on that. We want you to be knowledgeable about what's going on. We're not afraid to tell you about it. We're okay accepting no as an answer. But the last thing I want is for something to happen and a school board member going, you know what, this district was doing this. What is that all about? And you go, I have no idea. That's the last thing we want. So we want to tell you what's going on. So, of course, the Corey fees and the health insurance taxes, you know, that's going to be interesting going forward. Fully insured versus self-funded, that's what the sample is regarding there, just for your perusing. When you self-fund, you don't have, the health insurance taxes are not near as high. Fully insured, it's 2.6% this year. That's, you know, on your premium, that's a pretty good chunk of change. It's also a transfer of risk. Is it within your philosophy to self-fund or fully insure? We have a lot of schools that fully insure. Why? Because their budgetary authority does not allow them to have that kind of reserve funds or that creativity that they're wanting to take risk on. That's okay. But you have to understand how it all works, and that's our job. But in the marketing process, we will talk about both fully insured and self-funding, so you see it. The one slide, how stop loss works, it's just an FYI. When Kevin was talking about, you know, if you ever leave a group, or if you're self-funded and you ever leave, you have some financial responsibility for what we call terminal liability or IBNR, incurred but not reported. That way, when somebody says, well, you can go to a stop loss contract, you can look at them and says, which one? There are a lot of different ones out there. You better know what they're looking at. So, point is that you just got to be very knowledgeable about what you're getting into as far as risk financing, because that's what we're talking about. You know, in the national scene, they talk about, you know, healthcare issues. Well, to me, healthcare is the providing of healthcare. Health insurance is how you pay for it. So what we're looking at here is how you design a plan to help pay for those issues. Discussions, looking ahead. Got a picture of one of our dogs here, of course. We like that in my Ouija board. I'm a good predictor, prognosticator for the future. You know, what's the ultimate goal for the district funding? That's the number one obstacle. self-funding or fully insured, trust or whatever. Got to realize that bigger is not always cheaper. I don't know if you've ever looked with the Missouri Consolidated Health Insurance Trust. A lot of public entities in the state of Missouri, they don't even publish their rates anymore. Just because they have 60,000 people does not make it cheaper. It just makes it more predictable. So it's pretty interesting how people say, well, the bigger it is, the cheaper it is. Not necessarily. So we have to understand that. Plan designs, Kevin was talking about that. High deductible plans, how you compensate for them. I'm going to tell you something. We're going to do this with the Board of Police Commissioners. We implemented a high deductible plan, public information, this last year, but the board did not approve any contributions to their HSA accounts. Out of their 2,500 employees, we had one person take it. Why? It wasn't structured correctly. We're going to eliminate it this next year. Why? We don't have the understanding of how it's supposed to work yet. So let's take it off the table. Let's regroup. Let's think about it again for another year. And so, but to have it there, it's immaterial. So that's sometimes you can make decisions that sound really great in the committee, but yet it didn't implement right. Why? It really wasn't vetted very well. And that was in the middle of change of police chiefs. So we did have quite the communication structure at the time. But these are some of the obstacles that we see going forward. Disease is going to be the biggest issue, we think, going forward. Watching that and managing.
So, like we move forward, we move forward with you as a consultant and Holmes Murphy as the organization is.
As the broker, if you make a move. If you don't make a move, you just use Charlesworth Consulting. I'll still tap Kevin, and Kevin will we'll have to compensate him for his time and his team's time. We do that internally as part of that fee. But then if you stay, you stay. And then if you want to continue with Charlesworth as an outside consultant, I'm more than happy to do it. Love to do it. But it's just $3 per employee per month, and that's it. But Ms. Brooks, if you move away from this, there's going to be a lot of moving parts. And that's where Holmes Murphy, or any broker for that matter, is going to be very important. Yes, that's how we would structure it.
So I just want to make sure I understand it. So the first phase of just getting the quotes and then getting pricing from different carriers, that's the 8,300.
That's getting all the data, understanding your philosophies, getting doing the research on the organization, getting census data, getting plan summaries, getting everything put together so we understand what we're going to talk about as far as what are we going to look for.
Mm-hmm.
That's the phase one. That's kind of the get to know you phase. Then the phase two is the actual marketing, getting the proposals, getting it all together, coming back it together, understanding what's available to you or not.
So when does the additional 15,000 more 14,800?
That's only paid after the decision is made by the board either to stay or go. If you stay with the organization, that bill will be billed that month. If you move to Humana, that is waived. That 14,000 is waived. Because there's commissions.
If we decide to stay in the pool, we owe the 8,300 plus the 14,800.
That is correct.
But you provided all the data to help us make that determination
That is correct.
for those two amounts.
That is correct. And that is, that's how my structure, my company's always been built, fee for service.
In the RFP that you submitted, there was something about the online system for enrollment. Is that something that would be a part of all this?
No. Well, that's a discussion item.
Okay.
Shelley, is that the same as is that you're referencing the platform?
Yes.
Okay.
Yeah, we don't own a platform.
Okay.
We do that on purpose. Why? Because we've seen some brokers that offer a platform for no cost because it's built into their administrative overrides or wherever you go. It matters how it's paid. But it's their system. And that's wonderful, but if you ever leave them, you don't get to take it with you. You get 60 days. That's why we don't do it. Now, it doesn't mean that we can have a discussion about, oh, we have a deal with Solarix. If you handle these programs, we might be able to do it for, I don't know, they even charge.
Yeah,
To design
they don't
and
usually
the
charge
hours.
much, but
No.
we got that.
Oh, we have Navigator? Okay. All right.
So Yeah.
company Blue Springs is with, Avant, that's what I was reading.
Actually, we have Avant, actually, they're a parent company, they're a subsidiary of Holmes Murphy, they're one floor above us. And they have some pieces of your, program, but I don't know how much.
Just our,
Cancer or,
voluntary life and,
Okay.
all of that, so
Okay.
all of our ancillary.
yeah,
So-
Yeah, so there's a couple different things we can do on the benefit or on the enrollment side. One, with you guys working with Avant, we can definitely approach them. They're upstairs. We put plenty of groups on their Solarix model that they handle in-house, and they basically use the commissions to offset what that fee is. We'll use one of the carrier licenses, and so usually we can get that done for like hardly anything. And then we have our own system called Employee Navigator that we can that we provide. We pay one fee. You guys can we'll build your site. I actually build the sites myself. So I build just sites. It can connect to payroll vendors. It can do 834 files to your carriers. We could set it up a lot of different ways. Now to Bob's point, if you guys ever did leave, since it's our carrier license, they don't let us just keep it on the books moving forward. But if you do leave us, we're not the broker at all. Like there's some brokers out there that, so with Employee Navigator, you can't just say, hey, and move from this broker to this broker. It's one where you got to, basically, I provide all the information that they need to feed the new system. And then they just download it in there. If they were going to provide Navigator too, they would just, download all the information in there. So that would be no cost to you because I build that myself in-house, and we've already paid the licensing fee for the year, so it's going to be something. Now Solarix is a more robust model. I'm not saying that Navigator is the end-all be-all. It's a free option. And the first thing that we would do if you guys went with us is I would go talk to Jared. He's I've been at Holmes Murphy for 12 years. Jared's been there for 13 or 14. We basically started the office in Kansas City together. And I would just go up to Jared and I would just say, hey, here's the situation. You guys did the enrollments for the district last year. We need to get Solarix put in there at no cost. That's what I would tell him. I can't make any guarantees what he'd tell me, but we have a very close relationship. So I'm pretty confident that we could get a robust model.
yeah, that was created years ago, actually, when I was working with the district, a gentleman named David Wiggins with Workplace Possibilities.
Works
Yeah,
out benefits.
Worksite, thank you. We put him in, I did get in the middle, I just kind of coordinated and I got out of the way, to do those products. So I remember when that happened. But then he sold out to Avant.
Just here, the past couple of years, last year.
Yeah, probably 3 years ago now.
Yeah.
Anything else, anybody? Another question?
Yeah, I think I just stress the creativity part. That's really where we come. How do you used to describe us when you did the
Well,
RFPs?
when I used to do that, I called them edgy.
Yeah, we're edgy. We think
little
differently.
edgy.
We don't. If you just come with the same thing, it's not going to work for the organizations, especially coming out of a situation that you guys are in.
And we have fun. We have groundhog breakfast if you want to come up for breakfast, pancakes and sausage. And we have all kinds of, we just have fun.
I think when we spoke, aren't you in the same building as Hollis and Miller?
Yeah.
As what?
As Hollis and Miller.
Yes,
Yeah.
Halston Mills on 9th floor, 9th and
That's what I thought.
8th and 9th. So, and they have breakfast every Friday, so you get in the elevator, smells like bacon and eggs every Friday morning.
we heard.
And I've been there 2 years and I've never been invited.
We'll have to talk to Justin.
We do their benefits as well. Hollis and North. Yeah.
Thank you so much.
Yeah, thank you
for having
guys.
us. Here's extra copies
Don't
if you would
leave us
like them.
copies yet.
And we have to. Thank you for having us.
Thank you.
Good meeting you.
Very nice meeting you. Thank you for your time.
Oh, good seeing
Very nice
you.
meeting you.
Very nice meeting you.
Very nice meeting you. Thank you.
For public service.
Casey, I remember that one.
Nice meeting you, Mr. Casey.
Yeah.
No, they're a wonderful group of people. I really enjoy working with them.
Are you still with?
I still do, yeah.
Yeah.
They had some changes in the HR department, so we're going through those challenges now, which is good.
Yeah.
But,
Well, I ended up coming in.
they're just rock solid. I've got a really strong team, so I'm anxious to get.
And then Bob was stuck in there.
No, that's it. We just have the finance
Thank you,
report.
appreciate it very much.
have a quick finance report, right?
Yeah.
Right.
And then my,
And then
presentation
add-
about
the
the
agenda.
the
Add to the agenda.
amendment, yeah,
It is right here.
yeah. I can make that short for you too.
Why don't you go ahead
You want
and
me to do that while Shelley's out?
Yeah,
That'd be
Okay.
great.
yeah, why don't
All
you
right.
just go right ahead?
Finance Committee, I'm bringing tonight the memorandum for the board to, consider adding Attorney Taylor Fields as an alternate to attend the TIF Commission meetings. In the past, beginning in 2017, it was Ms. Wilsey, myself, and Dr. Skinner and Attorney DeHagen were listed as alternate members. And so wanting the board or finance to approve moving on to the board to add Attorney Fields to that list. And so wanted to move this on the agenda for the 16th, so that if for any reason Wilsey or myself cannot attend, Attorney Fields is able to do so in our place and can sit at the table and actually vote. At this time, he cannot.
And so, of course, Chris would be deleted from.
Yes, so we would, after Thursday, if approved, Ms. Payton would send to the TIF Commission and they'd have on file that this plan has been approved by the board.
Thoughts, you got a motion?
I move that, I mean, he's already attended it. I move that we,
He can attend,
He-
and it's
yeah,
open to
he's-
the
yeah.
public, but he's never
Yeah,
sat
he's
around
never
the
sat.
table for Hickman Hills items.
I move that we, allow, Mr. Taylor Fields to be an alternate, on the TIF Finance Committee.
I second that. No further discussion, all in favor?
Aye.
All opposed, okay, so,
So let's move to, be added on the consent agenda.
consent agenda.
Thank you.
Okay.
Okay, the financial update, as of December 31st, right now our projected fund balance is sitting at 14.722. With the addition of the tax anticipation note that we received, we ended the year at 13,000,007 in the fund balance. We did make payment of that 3.5 back to the bank last Friday on the 10th, so that is paid back already. As November 30th, the district owed $519,080 in surplus health insurance, and we made a payment of half of that December 20th before we left for the holiday of $259,540. So at this time, that's all we are showing still in deficit for our health insurance. I have not received the December financials yet though, so I'm waiting on those to see where we came in. But we've been doing really well considering where we were this time last year. Also our Jackson County, I didn't put it on here, but we've received in about 12 million so far in new tax revenue. So, and they did withhold a third of the 750,000 that we owe, that we're paying out over the next 3 years. So a third of that has been paid and taken care of. So,
Out of the 12 mil,
I'm sorry,
out of the 12 million?
yes, out of 12 million. So we were notified of that. So, and that'll be happening usually the last week of December is when they take that. So that first payment has been made.
Have we received our payment yet from,
We did. We received that 299,000.
the,
So we received it right after we spoke at the last
Yeah.
meeting.
Yeah.
we talked upon it this one, so
Yeah, that's what I said.
yeah, that's good,
That's
okay.
good for our money.
Okay.
Um,
Is that it, anything else?
not, that's.
Anything?
Yeah, I just have one. So you said we received 12 million? of
So
what
far,
we-
yes.
What we anticipate receiving?
Right, we received, about 2.4 right before we left for the holidays. We received a little over 7 million, the first week of January, and then last week, or the week that we were off. And then we received 2.6 million last Friday. So we're right around 12, 13 million that we've received so far in current revenue for our Jackson County.
And so how much more are we expecting to receive?
Well, we were a little over 50% in what we've received, so I'm hoping it'll be coming in. Usually this time of year we get a little bit more, but it all depends on whether people are going to pay their taxes. So, but we've received in just a little over 50% of the budget.
Well, I paid my taxes, so you ought to be able to.
Appreciate that.
And I
I
paid
have
enough,
to.
you
I do
paid
too.
enough that you ought to be able to get it, I'll tell you.
But there are quite a few disputes out there. And I know that there have been quite a few that have actually won those disputes.
I've sent in the deal and I've never, it'll be next year before they get around to me, so I'm not gonna worry about a refund if I win.
That's, any other questions?
And,
You know, it's good hearing that we have finally got our arms wrapped around this insurance deficit. Do you believe that there's a chance that we will find someone who will pick us up this year?
I really hope so. It would be really nice. I wanna make sure though that the benefit plan we're offering our employees is a decent plan, because what we're offering right now is really a good plan, but we're paying for it. So if we can get a little mixture of those, I can't.
do you have a recommendation based on the presentations?
I like Charlesworth myself, but I wasn't, I mean, to me, they're about 6 and 1/2 dozen of them. Oh, well, that's supposed to be. Oh,
What is the,
I mean, that would be my recommendation to take to the board, but I didn't know what your thoughts would be on that.
what are your thoughts?
Well, I just have one major thought about, and that is why would we pay twice for the discovery piece and then for the opportunity for them to bring us back some potential providers?
The way I understood it, and I could be wrong, but I thought part of that was the consulting fee if we chose to stay with the cooperative and we chose to have him as a consultant. We don't have to choose that. If we stay with the co-op, we don't have to hire him to stay on as our consultant. And if we go with someone else, then that fee is waived.
Yeah.
He gets paid through the insurance.
Right, but if we choose to say, okay, we're gonna stay in the insurance code, we owe him the $8,300 and the $14,800.
That's right, you did say that.
Yeah.
What was C-Business, do you remember? I'm sorry, 15? Was there not an additional to that?
They didn't, that's what I said, that was a clarifying question I wanted to ask.
Okay.
They didn't say it, but it's
I mean,
good.
And I do
just
have a
wanted to
fee
ask.
structure.
I can truly appreciate the timeline that they provided, but I think I do have a couple of questions regarding both proposals
Okay.
that I'm still kind of marinating on.
Okay, is this something we need action on this Thursday?
I would prefer it. Do you want,
The sooner the better, so they can start the process and then we meet our time frame in providing the insurance pool, what we're gonna do. Anything extended beyond extends it out where then the insurance pool isn't able to make adjustments for the upcoming year because they're then waiting on us.
Well, I'm willing to look very, listen and look very serious at your recommendation, because you're the one who has to be doing this, and it's a board decision, but at the same time, what we need staff for if we don't listen and don't follow the recommendation. But we're not the folks that are gonna be, we don't have a history of it. But I think if you have some further questions, maybe it'd be better to get those together, and so that we have.
I mean, it's just some technical questions, I
Yeah,
understand.
but we need to get, is the consultant and working with the company, if that's an issue, how much is that an issue over the earlier, the first, how much is it, I guess, the
I
difference?
feel like I saw something.
And is that, one was
The first crime referenced $15,000, but
thought
they
I
didn't
saw-
break it down in different phases in terms of the initial work. That I understood that was all inclusive in the 15.
And I thought I saw something that said $6,
I
per employee. but I'm not.
It's worth clarifying.
Yes,
To make
definitely.
sure.
So you want me to get those clarifying questions?
it's
Absolutely.
nice.
Okay. Alright.
And if you have any, I don't have any, but if you have.
And it would be nice to have a updated timeline based on
The
what you
second
just
one.
proposed.
Okay.
And so we won't put this on the consent, we put it for discussion.
Okay. Would you like to
But-
have them come to the board if you're going to do that? And see if they could present to the full board, or do you just want me to present
I mean, it's
information?
okay if she can answer the questions and
Yeah.
bring it back, I mean, that gives us
I
some
don't
more
think
time.
we need him to come
Okay.
back.
Yeah,
Perfect.
I mean, you just
I can
get
do
those
that.
questions answered,
Okay,
and just get back with us, I mean, it's only like 4 or 5 of them.
okay.
If you can send the questions tonight, and, I was just gonna say, I'm trying to think of a plan on how I can include it on consent.
It's
If we can
Thursday
get-
already.
Yeah,
Oh.
Thursday's gonna be here before we.
We
I
got
don't
all
even know that it's possible. It's probably just gonna have to be on, for discussion.
Yeah, but we can still, well, you still can be on the consent
Yeah,
docket,
you already have my questions.
yeah.
I think I had a question about.
But if it's just added to consent for, with her recommendation and you, what if the answers don't jive with what you were thinking, it's gonna be on consent with the recommendation from the team.
Yeah.
So,
I mean, I don't think it's a big deal. I think it's just a matter of just clarifying the two.
sounds good.
That's fine, yeah.
So you want the cost of staying with the co-op for both
Mhm.
firms, and then what was the other,
I mean, is there an additional cost if we have to stay with the consolidated school, whatever that,
okay,
yeah,
alright,
with that first firm, we didn't get a chance to ask that question.
okay. Alright, and I know he said, CBIZ did say something about an online enrollment, but there would be an extra fee for that. Did you remember that conversation? I wanna get some clarity on that, just to, on the enrollment piece.
And it'd be interesting to know why the HSA did not work, because they couldn't that potentially be a benefit to our employees, for tax reasons.
We have that, and we do have a contribution into, we have two HSAs and we have the contribution into one of them.
So will that still be available?
It would, we could definitely look at those plans, I mean, we haven't talked about removing
If that's
the
removed, then,
contribution.
I mean, it would be nice to know if that company will continue to allow us to, have that employee benefit pre-tax.
I would think that would be our decision, but I'll definitely find that out.
Okay, we've got that together then, I guess I should mention these future dates as we always do.
Oh,
The-
and Cecil remind the video that he has to excuse that.
I did, I did, yeah, thank you. The Parks Committee meeting is the 4th of February, 5:30, and Education Accountability is February the 10th at 5, and Finance Committee will begin on the 11th of February at 5:30, Facility Committee February the 13th at 5:30, and our regular session for the February is the 20th at 6:30. But I assume we'll have a closed session early, so at 5:30. If there's nothing else to come before this August body, I'll accept the motion for adjournment, but I will adjourn us.
Thank you.
Adjourn.
Thank you.